Hi, my name is Dr. Ramon Rodriguez. I am a movement disorders neurologist in Orlando, Florida. And today I am taking this opportunity to have a very short conversation about hallucinations in Parkinson's disease. And as I speak about this, I want you to understand that this is just general information. This is not intended to serve as a direct recommendation for you to make any changes to your medications or try to alter the medical treatment, but it is mainly intended for you to have a little bit of a better understanding about what might be causing the problem so you can actually have a conversation with your doctor and come up with a plan of action about what to do in case that this is a problem that is happening. Hallucinations can be fairly common in patients with Parkinson's disease. They actually can happen to people that they are not taking any medication. However, the one situation that we see quite frequently is that the medications that we use for the treatment of people with Parkinson's disease might be the trigger, can be sort of a magnifying glass for these hallucinations. So I want you to understand a little bit better about what are the main medications or the main situations that can trigger or exacerbate this problem. So you can actually be able to sit down with your doctor and have a conversation about how to make this better. So to begin, I want you to understand that as Parkinson's disease advances, there is a propensity for patients to have some hallucinations. Now, what happens is that the treatment that we give people, for example, let's say levodopa, might be a trigger for the hallucinations to happen in that particular patient. So there is always this belief that the hallucinations are always happening because of the medications that the patient is taking. And this happens because sometimes by lowering the dose of the medication, the patients might experience some improvement in the severity or the frequency of the hallucinations. But let me tell you a little bit better how these things work, okay? So in first place, when a patient with Parkinson's disease is experiencing hallucinations, the first thing that we need to do is look at what medications is the patient taking. For example, patients taking a class of medications called anticholinergics, and a good example of that one is trihexyphenidyl. Those patients might have a higher risk because this is one of the most common side effects of this medication. It might cause hallucinations. Another medications that might be related to hallucinations in people with Parkinson's is amantadine. And then the other class of medication that might be associated with hallucinations in people with Parkinson's are the dopamine agonists. So in this case, we're talking about pramipexole, ropinirole, and to a lesser extent, actually, rotigotine. And remember that what I am telling you here is about my experience. I see a lot of patients with Parkinson's disease, so I try to go one by one down this list of medications. And that's why, the most important thing that you can do when you're experiencing hallucinations or your loved one is experiencing hallucinations is to make a list of the medications that the patient is taking with the exact times and the exact dosage that the patient is taking and bring it to your doctor for your doctor to be able to evaluate this. Obviously, before we make any changes to the medication, we make sure that the patient is not having an infection. A common reason for triggers of hallucinations in people with Parkinson's are urinary tract infections. And let me tell you something. Sometimes patients are not having any symptoms. You don't see any discoloration in the urine. You do not have any symptoms of burning when they're urinating or frequency or urgency. So once again, this is something that your doctor will have to check. And the only way to know whether this problem is happening or not is to do the proper testing, which is a urinalysis and urine culture. Once we make sure that the patient is not having any infections and there are no fever, chills, or anything else that suggests an infection, then we go one by one down the list of the medications. So is the patient taking an anticholinergic? Is the patient taking amantadine? Is the patient taking one of these dopamine agonists? And if they're taking any of these medications, then what we need to do is try to begin tapering down. Now, I am not telling you to go ahead and start doing this. This is something that is very serious and you have to do it under the recommendation and the supervision of your doctor. But I just want to let you know that there actually might be a way out, and it's not uncommon for us to have people with Parkinson's disease that after lowering the amount of the medications that they are taking, then the hallucinations eventually will go away. So we do not have to do anything different. So once again, this is very important. Other than hallucinations happening in Parkinson's disease, something else that could happen are delusions. So let me tell you what the difference is. Hallucinations are basically when you see something that is not really there. Delusions is actually when you have these thoughts that something might be happening. So I am going to tell you one that is fairly common, and some of you might identify with this, which is delusions of infidelity, that the person with Parkinson's disease might have this idea that the significant other is having an extramarital relationship. So I see this quite frequently in my practice. And once again, this is the kind of medications, this type of medicines might just tip over the brain to begin having this belief. So once again, this is why this is so important that you bring a detailed list of the medications. And then some information that will be very valuable is if you can think about the onset of the problems and try to relate these to taking certain medications, then that will help your doctor even more. Now, the other thing that you have to remember is this. Parkinson's disease is a progressive condition. And you might have been taking your medicine for some time. However, maybe a year, 2 or 3 years later, your brain might not be able to tolerate that medication. So once again, the fact that you have been able to tolerate that medicine for 2 or 3 years without having that problem, and the problem is happening now, doesn't give us a lot of information. We still have to go down the list of the potential triggers for this problem in order for us to be able to find an answer. Now, let's say that you already minimize as much medications as you were able to do, and the time will come that lowering the amount of the medications might actually aggravate the symptoms of Parkinson's disease. And increasing the medication will improve the symptoms of Parkinson, but then the patient might be having some hallucinations or some more delusions. So, that will be the time where we need to consider treating the patient with a medication for hallucinations. And we have to be very careful because even though in psychiatry and mental health medicine, there are many medications that can help lower the number of hallucinations. Remember that a lot of those medicines are dopamine blockers. And dopamine blockers, if you start thinking about it, if you begin to block dopamine, then the symptoms of Parkinson's disease might get worse. So at this point, it becomes critical that you sit down with your doctor, you have this conversation, make sure that your doctor understands what is happening for the proper treatment to be started. So we have good therapeutic options for this. They are FDA approved, and for most of you with insurance, your insurance will provide coverage. But once again, the first thing is, and always, my rule is, I like to avoid adding more medicines, right? So many times by making some changes to the therapy that the patient is taking, that might be all we need to improve the symptoms. So for many people, that might be the answer. But then for those that unfortunately do not improve despite making those medication changes, then there is some therapy available that, once again, I am not going to go into details about that, but you should be able to discuss that with your doctor. So once again, I just want to provide short information. Remember that this is very general advice. I am not telling any of you, go ahead and change your medicines, do this or do that. I want to provide you with some of the resources and the tools that you need so you can go back to your doctor and have this conversation with him. So once again, thank you for your time. I really appreciate it. And actually, some of this information is available in my book, which is called Troubleshooting Parkinson's. And I actually came up with this book. I used to participate in a forum answering questions for people with Parkinson's. So I have been able to understand what are the most typical questions that patients are having. So I hope that this information is helpful to you or your loved one. And I will be posting some more videos about other frequent problems that we see in people with Parkinson's disease. I hope that this helps, and I wish you good health. Thank you.